Hello, everyone. This is question 11 of the 100 clinically oriented anatomy questions. Let's get straight into the video. Question says a 49-year-old man underwent a coronary bypass graft procedure using the great or the long saphenous vein. Post-operatively, the patient complains of pain and general lack of normal sensation on the medial surface of the leg and foot on the limb from which the graft was harvested. Which nerve was most likely injured during the surgery? Option A, the common fibular nerve, the superficial fibular nerve, the lateral sural nerve, saphenous nerve, and the tibial nerve. Now, one of the things that we must establish is that the the great saphenous vein is the vein that is used for coronary artery bypass grafting, and the nerve that lies very close to this vein is the saphenous nerve. The vein runs medially from the medial margin of the sole of the foot anteriorly to the medial malleolus and then goes up to terminate into the femoral vein at the saphenous opening. So now the nerve that runs at the front of this great saphenous vein is actually the saphenous nerve. And if the healthcare worker is not careful enough while harvesting the grafts of the great saphenous vein, the healthcare worker might actually injure the nerve that lies closely to the great saphenous vein, which is the saphenous nerve. So maybe in this case, it's not even a matter of maybe here. That is what actually happened. So post-operatively, the patient complains of pain and great lack of sensation on the medial surface of the leg and foot of the limbs from which the graft was harvested. So it means the nerve was injured while harvesting the great saphenous vein. And the nerve that lies close to the great saphenous vein is the saphenous nerve. And don't forget, the cutaneous innervation to these places is actually from the saphenous nerve, right? L4 to be specific. So, yeah, the correct answer is the saphenous nerve, which is option D. So, option D is the correct answer. So, let's check why other options are wrong. The common fibular nerve is not the correct answer. Now, why is this? This is because the common fibular nerve bifurcates as the posterolateral part of the neck of the fibula into the deep fibula and the superficial fibular nerve. It's it runs laterally basically. The vein runs medially, common fibula runs laterally. They don't have any relation. Same with the superficial fibular nerve. The superficial fibular nerve also runs laterally, so it does not have any relation to the great saphenous vein. The lateral sural nerve, from the name the lateral sural, so it means it does not have anything to do with the great saphenous vein. Lateral sural nerve supplies the skin on the lateral border of the sole of the foot, and then the superficial fibular nerve supplies almost all the skin on the sole of on the dorsum of the foot, except for the first interdigital cleft, which is supplied by the deep peroneal nerve, the medial border, which is supplied by the saphenous nerve in question, and then the lateral border, which is supplied by the sural nerve. So every other region apart from these three regions are actually supplied by the superficial fibular nerve, and it also supplies the lower one third of the lateral leg actually, superficial fibular nerve. So more so, the superficial fibular nerve is also regarded as the musculocutaneous nerve of the leg because in its upper parts it supplies muscles, that is the fibularis longus and the fibularis brevis, and then its lower part it gives cutaneous innervation. So it gives both muscular and cutaneous innervation. That is why it is regarded as the musculocutaneous nerve of the leg. That is just an additional info. Now, the other option is tibial nerve. The tibial nerve is definitely not correct. Tibial nerve runs posteriorly and supplies the posterior leg muscles, which are responsible for plantar flexion and flexion of the toes. So the correct answer is the saphenous nerve, and I believe you understand. And I'll see you in the next video. Make sure you like, you subscribe, and you comment, and I'll see you in the next video. Thank you.